They're worried that patients with serious conditions like strokes or heart attacks are staying away from hospitals because of coronavirus. It's believed that some people with health problems fear going to the emergency department of a hospital that would expose them to COVID-19. Doctors are advising patients with potentially life-threatening conditions like heart attacks to seek help. We're joined now by Dr. Katherine Henderson, President of the Royal College of Emergency Medicine here in London. Dr. Henderson, I would imagine people don't just stop having heart attacks or strokes just because there's a pandemic. Are those patients now staying away from hospitals?
It certainly seems unlikely that we would have seen an acute reduction in the number of people having those sorts of medical conditions. You can understand people not having car crashes, but you can't understand people not having strokes and heart attacks. But we've certainly not been seeing them coming into the emergency department.
You can understand, though, the fear in some of their minds. If they're feeling unwell, they might think, why risk going to a hospital and catching a disease which would make it even worse for them, that they might try to ride it out at home. How can you convince them that it would be safe to go and seek treatment?
I can absolutely understand that fear. So what they need to understand is the practical measures that we are making to make it safe. We can't make it zero risk, but we can reduce the risk as much as possible. And we do that right from the beginning. From the moment they arrive, we have our departments divided into areas where the patients there are COVID likely and patients are COVID unlikely, so red and green zones within our departments, so that we can manage patients in an area that's appropriate for them. So somebody who presents with a problem that doesn't seem to be COVID related will still be seen by a healthcare professional wearing a mask. They'll be in an area where there's space. There will be staff that are staying in that area all day, and we will do everything we can to make sure that they're kept safe.
Do you think people know this? Because if they did know this, surely they would be going to emergency rooms.
I think we've been saying it quite a lot, but I still think it is, people are concerned. They don't want to call the ambulance. They don't want to bother the NHS, which is lovely of them. And I think that it's exactly the people who often have the most serious symptoms who are being the most stoical about their symptoms, who don't come to emergency departments. But this is something we're going to have to live with for quite a long time, even when the lockdown comes off. When we're starting to open up services within the NHS again, we're going to have to work out how we keep everybody safe. The traditional emergency medicine prior to all of this happening was crowded departments. We clearly can't go back to having crowded departments because we've got to keep people safe. We've got to keep patients safe, and we've also got to keep staff safe. So the new normal in an emergency department is going to be different from what it was like in the past.
You've talked about a new normal and talked about this crisis continuing for a very long time. One rough and ready way of counting COVID deaths is excess mortality. And just to explain to viewers what that might be, comparing deaths, let's say, this April to last April, and assuming that the excess is from COVID patients. But as this goes on, is it likely that the excess mortality would also have to include those with heart attacks and strokes who could have and should have got treatment but didn't?
Well, that's exactly the worry. We obviously expect there to be deaths that are COVID related. We expect there to be deaths that are likely to be COVID related. But what we don't want to see is people coming to harm because they haven't come. Now, some of that won't happen immediately. Somebody who has had the minor symptoms of a stroke who doesn't present, doesn't get the preventative measures, and they then may come with a completed stroke. That's what we want to avoid. Or somebody doesn't come with a heart attack and then can't get the time-critical interventions that they could have had if they'd presented early. So there can be a lag of harm both for the immediate health problems, but also going on in that person's health. They may have more problems than they would have had later on in their life.
Dr. Katherine Henderson, thank you so much.
Thank you very much.